rating को
Doctor Ayurveda and Director Sorry. I request everyone to put their mics off and videos off. Ayurveda Sarevi for their constant great motivation, valuable direction, encouragement, which catalyzes all our efforts. Now, in today's session, we are blessed to have with us with a great presence of respected Professor Dr. Avinash Lele sir from Pune, Maharashtra, as a guest speaker. And sir is going to enlighten us on a very crucial and very important topic, Ayurvediya Atyek Chikitsa, emergency treatment through Ayurveda. It is believed that emergency treatment is not available in Ayurveda, and in such conditions, only allopathic medication have to be taken. It is not that the texts are not having any description of management. Ancient acharyas have used the various terms like Ashut Parit in emergency condition where quick management is needed. In Sushruta Sahita also, specific methods in emergency condition is mentioned. So to explore more on this topic, stay tuned. Now, I would like to invite respected N. Ramakrishnan sir, Administrative Officer, RAV, for a welcome address. Over to you, sir. Ramakrishnan sir. Hello, Ramakrishnan sir. Am I audible, sir? Hello. Hello. Am I audible? Hello, Ramakrishnan sir.
Madam.
Am I audible? Can you please?
Madam. सर शायद जुड़े नहीं है सर, क्योंकि आवाज तो आपकी खूब आ रही है, सब सुन पा रहे हैं, लेकिन शायद सर नहीं जुड़े हैं.
Okay, thank you, sir. Thank you. Now, I would like to share the brief introduction of our today's respected guest speaker, Professor Dr. Avinash Lele sir. Sir has graduated from Mumbai University, first with distinction in surgery at Shalakya. Sir also did post-graduation MASc Ayurved Nishnat in surgery and Shalakya. He also possesses academic teaching experience as lecturer, leader, professor at Tilak Ayurved College and Tarachan Hospital, Pune for 15 years. He also served as first principal of Sumatibai Shah Ayurved Mahavidyalaya, Pune, Maharashtra for 2 years. He has translated 3 books, namely Bahugni Avla, Panchkarma and Ayurvedic Massage, Secrets of Marma Therapy in 14 foreign languages. Sir also rendered their services as visiting professor in different institutions and universities in UK, USA, Canada, Brazil, Portugal, Germany, Italy, Switzerland, Austria, France, and many more. And at the end of session, in a question and answer round, you can ask the questions. Now, I request Professor Dr. Avinash Lele sir to please proceed with the session. Over to you, sir, and welcome.
Dhanyavad. Namaskar, Dr. Poonam, Radhakrishnan, and everyone. Thank you very much for giving me opportunity to share my experience. The topic is Atyayik Chikitsa through Ayurveda. Now, emergency and the regular treatment has two very different aspects. Otherwise, when we are treating our patients, first we diagnose, we ask the history, and then we follow the treatment. But here in emergency, no history, no questions. First we have to treat, and once the patient is settled, then we are supposed to ask him why this has happened, how this has happened. So this is the basic difference. Now, what are the types of emergency we say? The first is the life is in danger. And the second is the problem is occurring in the remote places where the medical facility is not there. Another type is we can tackle or we can treat such emergency serious patients in an hospital or in a well-equipped ambulance. But then it is easy. Everything is available to us. But sometimes we have to face such a thing where the medical aid is not at all available. My first request to all of you that if you get some patient like this and if you want to treat, the first thing that you must see, because the patient is unconscious, he is not going to talk with you, that whether he is alive or dead. Yes, this is very important. So please check the pulse, the heart rate, the respiration, and most important is the corneal reflex, because the patient usually is in the shock. So his pulse is very feeble. You cannot record his blood pressure. His skin is very cold and clammy, and his respiration is also shallow. Once you are sure that he is in shock but alive, then you can start giving him your emergency treatment. Now, emergency is the situation which comes in front of us without any notice, stands like a rock, challenge your knowledge, experience, and the common sense. Actually, this is your real test of all your experience and knowledge. Here you have an opportunity to prove that Ayurveda is not only for the chronic disorders and it takes long time to cure. This is a long time misunderstanding about the Ayurveda, that you must use Ayurveda only in chronic diseases, and people assume that it will take a long time. But my experience is, after having some problem, people go to one or the other therapist, treatment, pathies. They take the treatment. When they fail, then they come. So the pathology is bigger, and that's why it takes more time. Another thing is we call ourselves as Ashtanga Ayurveda. Out of 8 branches, Kaya, the medicine, Bala, pediatrics, Graha, psychological problems, Urdhvanga, ear, nose, throat, and eyes, Shalya, the surgical problems, Daunshtra, the poisonous or food poisoning or any sort of poisoning, and Jara, geriatric. Except Rasayan, all these branches need an emergency approach. So this emergency can happen in a baby, it can happen in a senior citizen, or it can happen in any of the branch. In my lecture, I'm going to talk a lot about the marmas. So let us have a basic idea about marmas. Marma are very similar to the Chinese acupressure points. But see how they say acupressure points. But our marmas are not the points. These are the different areas. And we measure them in Anguli Parima. We have our own style of measurement, like half Anguli, 1 Anguli, 2 Anguli, etc. By definition, we remember that Marayati, Marayanti iti marmaha. That is true, but I found that Tarayati, Jivanadayini iti marmaha. And you can take the example of a knife. We can, because we use it, okay? We use it in operation theater and in the even in the clinic also for the minor surgery. How is that? The knife can be used to suicide, to kill somebody, and also it can be used to heal. See, when as a surgeon, when the patient come to us, he give us written consent. He requests us. He gives us a lot of money and tell us, please use this knife on my body, because he know that this knife, when I'm going to use, it will cure him. Now I will go to my childhood, because there is a lot of impact on my growing age. I was in Mumbai. My father, I'm talking about 1954 to 74, the 20 years right from my school till I become the graduate. That time my father, Dr. M.Y. Lele, was the dean, the head of the hospital, research institute and college in Mumbai, named as Poddar Medical College and Hospital Campus. The speciality of this hospital is like any allopathic hospital. This is the only hospital, Ayurvedic hospital, I'm telling you, which has casualty. Casualty means they accept every cases, a case of burn, a case of accident, homicide, suicide, and even the police was there to register the FIR. And as a dean, as the son of the dean, I was having an access. So right from my childhood, anytime the siren of the ambulance I hear, I was running to this casualty department and watching how the casualty medical officer diagnose and handle these emergency cases, how they bring the unconscious patient to the consciousness. This is how I decided to join the Shalya department for my postgraduate study. Importance of Marma Gyan, the knowledge in emergency. All of us, we have studied the Marmas in our first year subject, Sharira Rachana. But that is just to get marks in examination. We have no idea how this will be life-saving knowledge in our future. And that's why we mostly, many I have seen my students, they fail to remember the position and the connection of these marmas to the different systems, srotas. If we add applied anatomy with lot of examples, I'm just talking about the teachers who are teaching the Sharira Rachana. If they also start teaching the applied anatomy, then I think the future students can utilize this knowledge in their practice. Now, instead of lining up names of different marmas, let me narrate few live examples during our here in India, Pune and Mumbai, as well as abroad, how we use this knowledge of marmas. While flying to Europe and United States, we usually prefer to fly with the German air company named as Lufthansa. And we live in Pune. It's far away from Mumbai, and I'm just talking about 1990 to 2000. That time there were no expressways. It was taking about 5 to 6 hours, and usually the flights were early morning at 3 o'clock. So we have to call all our patients to see them. Then afterwards pack off because we were just visiting the different continents in the same. So the bags were also heavy. So we were just going to the airport, and it's a very tiring journey. And early morning, maybe 3 o'clock, the flight was going. Once the flight settles at about 36 to 37,000 feet, the crew offer nice hot meal to all the passengers. Once that is over, we can rest in an inclined position in a sleep and sleep for maybe about 4 to 5 hours. So as we were very tired, both me and my wife, we relaxed, closing our eyes with the iPads and covering them ourselves with a warm shawl. But just within 45 minutes or 1 hour, the air hostess came to me and gently said, "Excuse me, Dr. Lele, we need your help urgently." Actually, we were used to such type of attending the emergencies as well as the labors and delivery cases, even at midnight at our clinic. But we never expected that this can happen. This emergency can happen in the sky. It was very unexpected. It was my fault to register both of us as a doctor during my flight booking. And that's why the air hostess was knowing that we are doctors and we might be very helpful. Now, why she was calling us? The incident was as follows. A young couple from Orissa with 5 months old baby, they were flying to the US in the same flight. The baby was crying and vomiting, and the primipara, the first baby, uh, with the fear of what will happen to my baby, the mother was under tension and she was also crying. So the passengers in that part of the flight were uneasy. They were not able to sleep. So when the air hostess asked us, can we help? Definitely we went, and we requested the air hostess and the crew members to bring them in their service area so that the other passengers will not get disturbed, and we also have a space to examine the baby and handle the situation. So they have brought the baby as well as the mother to their service area. On the flat surface, we have examined the baby and we found that the baby has adhmana and ajirana, the indigestion. His tummy was tense and there was tachycardia also. That indicates that this was not merely a travel sickness. Fortunately, no severe dehydration to the baby to start the intravenous fluids. The treatment was necessary for both baby as well as mother. Mother to give the confidence that she is not alone. So the first what we have done, we have assured the mother that she is not alone and helpless in this plight, but accompanied by a surgeon and gynecologist, and the baby soon the baby will be okay. With these words, she relaxed, stopped crying, and started cooperating with us. Now, actually, the first aid box as well as the oxygen cylinder are available in all the flights, but all the medicines that they have are allopathic. It is not that we are afraid of using the allopathic medicines, because as we work in the operation theater and the delivery room, we are used to use them very often. But we use them right from the beginning only when they are essential. Another thing I want to clear in the beginning, that teaching Ayurveda abroad is always with the practical demonstration. And that's why in our baggage, we always carry something to do the practicals which are not available in those countries. Our students, if they just only listen to the theory, they don't believe it. But if we ask them to do the practice, demonstrate something, ask them to participate, then they start believing, oh, this is not only mere a science or historical one, this is really practical and applicable. So, and that is why we always carry a rough stone, uh, what we call as sahan, like this, a rough stone. Usually, all of us, we when we do the puja, we usually rub the sandalwood and prepare the sandalwood paste to apply to the god. The similar one, we always carry one with us. Along with that, we have a, of course, the white sandalwood, then the red sandalwood, then calamus, turmeric, dry ginger, all in a raw, solid form. Also, we carry the nutmeg and some powder of cumin seeds, coriander seeds, and a powder of calamus. The to balance dryness in the flight, all of you know that the atmosphere in the flight is very dry. So it is our habit that when we sit in a long flight for 8 to 10 hours, we usually put oil to our face, ears, so that we don't feel that dryness. So we are, in short, we carry the grandma's purse, in short. So putting that oil, so my wife, when she observed that the tummy is tense, she decided to put the oil uh, on the baby's umbilicus and the surrounding area. She requested the air hostess to bring some hot water, and then she put the oil bottle in that hot water, making it warm. Then Bharti poured gently the warm oil over the baby's nabhi marma, umbilicus, and massaged gently clockwise. Meanwhile, she asked me to bring the rough stone, that is sahan, from our carry-on bag, and then she asked me to rub or to prepare the little paste of hing, what we call as asafoetida. Then air hostess also provided us some hot napkins with which we have started doing udara Svedana for the baby. The baby enjoyed these activities. Baby was relaxed because the tenderness of the tummy got reduced, and that's why the baby stopped crying. We applied the hing paste over the nabi and surrounding area, and again covered the same area with the hot napkins. That has helped to reduce the tense gases inside, and the baby was relaxed. Watching this baby, mother was also very relaxed. Then we were knowing that this indigestion is coming from the mother, and that's why we asked for a glass of hot water and added some cumin and coriander powder, little salt and sugar, and asked her to drink the same sip by sip, not at a time, but sip by sip. So this Nabhi Marma Chikitsa was very, very useful. I want to tell you that a common sense is very necessary, and you are of course, before landing on Blackboard, this Nabhi Marma Chikitsa was very helpful. Yes, what I wanted to tell you is it is not always the medicine, the assurance, the confidence that you are not alone. I mean, the treatment for the mind is also very, very important. Once we have assured the mother, and when she has seen practically that the baby is getting relieved, she is not alone in the flight, that has worked very nicely. It was a very important problem for the Lufthansa crew. So before landing on Frankfurt Airport, air hostess requested us to sit till all the passengers go out of the flight. Then the pilot, along with all crew members, clapped for our help. Of course, we received a bottle of champagne from the pilot as a token of gratitude. Vielen Dank. Thank you very much, the pilot said. And I'm very happy to tell you that even in the emergency, if you use your common sense and if you carry some of the simple things with you, you can treat the emergency. Let me give you another example. Very often we started our journey in United States from East Coast, uh, do the demonstrations and lectures in New York, the neighbor, the Boston, and the surrounding area like Washington D.C., and then go to the Texas and ahead to the California. So, like our usual autumn and the spring, in one of the autumn we were flying to Boston twice every year, the spring and autumn, to teach Ayurveda. There was an institute, New England Institute of Ayurveda, which was in the city of Worcester. We are supposed to land on the Logan Airport in Boston, and about 100 kilometers, there was an institute where we were teaching. We stayed as a paying guest with one lady, Anne Russell, a 65-year-old midwife. Except her, two big hairy dogs at her home and car. Everything was very fine. We enjoyed stay with her. Once on free day, when we were not teaching, she asked if we have seen any typical Catholic marriage ceremony. We said no, we have only seen in the picture, and if she is willing to show us, we will be very happy. So she invited us, and we went to a ancient cathedral up in the hills of New Hampshire after a 3 hours drive. It was very beautiful, and many cars and the well-dressed invitees uh, were there. The photo session was going on with a couple. We went inside because the cathedral was very huge and ancient, and Anne wanted to show us everything. She was telling us the history and the art and telling us about the paintings inside. Meanwhile, two old, about 80 to 85 years old American ladies entered the hall. We heard the wheezing sound like asthmatic client from one of them. So Anne approached them to ask for any help. They were friends, and the same lady who was having that wheezing sound, she has driven the car for about 2.5 or 3 hours. She was a known case of high blood pressure, but she said, "No, I'm okay. I have driven a car for a long time. I am little bit uneasy, but I feel I will be okay." And so again, the we again started watching the paintings on the wall. But within few minutes, we heard a noise of someone falling down on the ground. It was a big, big noise. And when we saw back, that old lady with high blood pressure has fallen down after fainting with few convulsions. Uh, so we rushed to her. This was a dire emergency. Someone ran to call the ambulance. Even though this is a very advanced country like United States, even the air ambulance will come there immediately, we were knowing that it will take minimum 20 minutes because it is far away from the main city and it is a thick jungle. But we understand that even air ambulance has to reach this thick jungle up in the hills. It will take at least 20 minutes. Until that, as a surgeon, we were knowing that every minute is very important because she is in a stroke, having convulsions and lack of oxygen. So and age is also more. So immediate treatment was necessary. Every minute was precious. Why? Because if that lady vomit, and if all that vomitus, the matter enters into the trachea and lungs, she will die before the ambulance comes, reach the place. And that's why, again, uh, hello, I'm continuing, okay? And we ran to her and told to the people that she is a midwife and the other person is a doctor from India. So before emergency squad reach the place, we are going to help her to save her life. Is that okay? And the people say, yes, yes, go ahead. Please help that lady. We ask the people first what we have done. We ask, hello, please don't talk. Let me continue my talk. I am getting disturbed. Please. We ask people to open all windows.
Hello, Dr. Elisa. Can you hear me? I request everyone to please stay connected. There might be some network issue and keep your mics off during the session as it's disturbing.
Dr. Poonam, may I continue?
Yes, sir. Yes, sir. Please continue.
Okay, thank you. So I turned her on sides and holding her head, extended her neck to prevent the closure of the trachea. This is very important. Let me request you that if you see anybody going into the stroke, the first thing, don't allow them to sit with the head up. The head down position is very, very important. At least flat on the ground. And then turn them on any side, right side or left side. Again, the neck should not go to the chin should not go to the chest. You are supposed to extend it so the trachea is open and they are able to take the they are able to take the respiration, the air. Another thing that happened, that when the person becomes unconscious, see, we are conscious and that's why we are holding the tongue, okay? But when the person is unconscious, he doesn't understand anything. So his tongue uh, falls down and blocks the air passage, nasopharynx also. And that's why we turn them either on the right side or the left side. Remember, the resuscitation has nothing to do with homeopathy, allopathy, or Ayurveda. This is sympathy. We are supposed to save the life. So all the principles are same in all the pathies. So she became extended. So we have extended her neck to prevent the closure of the trachea, to prevent the backfall of tongue. I hold her tongue gently with my handkerchief because there was no spoon or the tongue depressor. But as an Indian, we always carry a handkerchief, a cotton, in our pocket. So I've just taken it out and hold her tongue. Within few minutes, she started vomiting forcefully, which was expected. But vomitus came out on my hand, with which I am holding her tongue, as well as it, all the vomitus fallen on my shirt. But I was not uneasy because her life was more important than my shirt. She became semi-conscious as the vomitus came out, and as she has started breathing, she has started gradually coming to the consciousness, but not complete. So I asked Anne to hold her hands and went to give her the Vidura Marma pressure. Now, do you remember where this Vidura Marma is? It is behind the ear. In the behind the ear, there are two round bony prominences. We call it mastoid bone. Go down, and in that dimple, that soft area, that is the Vidura Marma. This is very important. So I have started giving her Vidura Marma pressure with my both the thumbs and irritating her. This is very painful, and actually I wanted to give her Trasana Chikitsa, the pain making treatment. Why? Because I wanted to bring her conscious. This was very painful for her. Do not put pressure behind my ear. Who are you? Get out, she shouted. I reduced the pressure and gently requested her to open her mouth and start deep breathing. Inhale and exhale. And while exhaling, make a noise like that, so that the carbon dioxide will go out and she is able to inhale very properly. I told her if she follow my suggestions and start deep breathing, then I will not a pressure. Otherwise, again, I will make the pressure on the Vidura Marma. Start deep breathing. Then I will not press behind her ear. She started deep breathing and recovered till the rescue team reached. So again, I just want to remind you, my dear friends, with this example which has happened in New Hampshire, we were able to save the life of an American lady on her own land. Friends, during treating a case of shock, a stroke, fainting, giddiness, unconsciousness, resuscitation to provide proper prana, oxygen, to brain is very important. It is not Ayurveda, homeopathy, or allopathy, but sympathy and quick action is necessary. Remember that brain is the only organ in us which is deprived of oxygen for a long time, get damaged, which is irreparable. The damage is permanent. If it is unconscious and not coma, then with such trasana chikitsa, it is possible to bring patient to consciousness. So he or she can breathe themselves to save their brain and life. So this is another example. I have many examples with which Ayurveda, I mean this Marma therapy, has had a lot. Seattle to Seoul, this is another example. Many times we travel from transatlantic or sometimes trans-Pacific. I'm just telling you that after teaching on the East Coast, we went to the West Coast and started teaching, completed the teaching in Seattle, the Northwest. There is a university, there is a naturopathy university in Seattle named as Bastyr University. They have various subjects, including the Ayurveda. They accept Ayurveda as a naturopathic medicine. So they have the herbology, Ayurveda, natural diet and nutrition, etc. We taught Ayurveda here for many years. Once, after completing the hectic schedule of teaching from 9:30 a.m. to 5:30 p.m., non-stop talking, we boarded a return flight to Mumbai via Seoul of Korean Airlines. That was at 11:30. So, all the day we were teaching and speaking. So after dinner, we slept and relaxed in the flight, and thinking that the flight will reach to the Seoul, and then we will just change the flight and come from Seoul to Mumbai. But that was not going to happen. After the dinner, we slept and relaxed. We heard an announcement that one of the passengers got fainted in the toilet. One of the passengers was fainted in the toilet, and the crew need urgent medical help. With reflex action, without my brain's notice, I raised my hand to inform them, the air hostess, that I can help them. Immediately, they asked me toward the place, they asked me to come and help them. They brought me to the place of incident, that is the toilet area. Once I saw uh, the lady, all my sleep has gone. All my sleep has gone. And I was started thinking, oh, why I have raised my hand? Because she was overweight, fallen on one side of the toilet and gasping. As the flight toilets are very narrow, it was impossible to treat her there. So I requested crew to bring her in a service area. Believe me, she was so obese that 6 crew members as well as sturdy passengers were needed. I repeat, 6 people needed to bring her out of that toilet in a service area. Do you know, when the person become unconscious, he become more heavy, and that's why it usual I ask them to put her down on the floor. As I told you, I first check her pulse, respiration, and confirm that she is not in the coma. Meanwhile, I went to my seat and brought the calamus powder from my handbag. Like New Hampshire, I have just told you the story. With the help of crew members, we turned her on one side. It was necessary to turn her on one side. Putting spoon in her mouth gently. Then I put a pinch of calamus powder in both of her nostrils, pradhamananasya, as we do it with katfal. Similarly, I pressed area between her thumb and index finger. Now, as she was very obese, I have decided not to use the Vidura marma, which I have used in the other incidents. I decided to use the Kshipra marma. And again, the Trasan, the pain therapy or irritation therapy. She started breathing. After a few seconds, a calamus reached the inner nasal lining, causing her irritation and sneezing off and on. So she started sneezing again and again. So her nasal passage got clear. And with the pain that I have made in the Kshipra marma, in the Kshipra area of her palm, both the palms, she has started breathing regularly. And as she has started breathing regularly, then her consciousness came. She sat down by herself, asked for water. After taking sips of warm water, uh, and then we have realized that she is a known patient with cardiac problem, diabetes, high blood pressure, and was dependent on oxygen. She was traveling with physician's travel fitness certificate and even an oxygen cylinder, which was next to her business class seat. Remember, see the effect of Ayurveda. If you use your common sense, if you have a proper knowledge of connection of the marmas to the different systems and srotas in our body, you can treat a very complicated emergency case also. Once again, received thanks from the crew. After 2 months, I received a courier from the Korean Airlines, a bunch of USB drives as a token of gratitude. Now I give you the third example, a Thanksgiving party, usually which happens in October and November. I told you that on the West Coast, we always started teaching first in Seattle, the Northwest up part. After the Bastyr University, usually we were coming down to San Francisco. 1 week in San Francisco. Usually the Friday, Saturday, and Sunday we teach. And on Monday to Thursday, we do the consultation. And then we fly to the next city. So this way we have taught in Seattle, then we taught in San Francisco, and then we went to the Los Angeles, and then we went to the Honolulu, Oahu, the Hawaiian islands. So we taught basic as well as advanced clinical Ayurvedic subjects such as Ayurveda and Marma therapy across Europe, Brazil, and United States. While teaching on the West Coast, usually 1 week and teaching in one of the city, then fly to the next. Do consultations from Monday to Thursday and again teaching weekend. Thus we taught Marmas with practical training at Seattle, San Francisco, LA, and came to Honolulu. While teaching on Oahu Island, I got a mail from one of my students, Catherine. Actually, I was confused because she was not here in the Hawaiian island. I have taught her somewhere in San Francisco. And now she is telling me that I have saved her mother. I got confused in the beginning, but after reading her mail in details, I understood that she used proper marma right in time, which literally saved her mom's life. Let me tell you the story like it is. After attending marma therapy class, physically practicing exact marma areas on each other's body, she happily went home to participate in the Thanksgiving party. Now, all of you might be knowing that the roasted turkey is the prominent symbol of such family gathering and the Thanksgiving dinner. As a senior-most member, her mother was at the center of the dining table with 15 to 20 family members chit-chatting and enjoying the lavish dinner. Her mother swallowed a piece of roasted turkey, and while she was talking and smiling and laughing, that piece of roasted turkey meat stuck up in her throat. She tried to cough it out, but failed. Let me tell you that she is an aged, more than 80 years old. As the head of the family, she is sitting in the center, and a piece of meat has stuck up in her throat. She became breathless, gradually becoming cyanosed. This was a dire emergency. There was a pin drop silence. All chit-chatting, smiling had stopped. Her brother stood behind mother, and her means Catherine's brother. Immediately he went on the back of his mother and started patting on her back to help her throw the piece of turkey. Till now, she started fainting, tired, and about to collapse. Everyone felt so sad and helpless. Everyone felt so sad that they are there in front of them. The, the main person of the family is fainting, getting collapsed. What to do now? Even patting has not also helped. But suddenly, the Catherine remembered something. Quickly, she went on the back of her mother and forcefully putting pressure by her thumbs at Aunsa Marma, Aunsa Palaka. All of you must remember that on our back there is a bone named as scaphoid, that is Aunsa Palaka. And on our shoulders, let me show you that if you take your right hand and put it on the opposite side, that is on the left side, and with the middle finger, if you press it like I'm showing you, this is the area where there is a ounce of marma on both the sides. If we study deep, she was remembering. Catherine immediately, just a minute, I have to connect my laptop because my battery is low. 1 minute. Okay. So, sorry for but I've forgotten to connect it, uh, the wire. So I'm just telling you the story of Ausa Marma. So Catherine remembered something. Quickly, she went on the back of her mother on the back of her mother, forcefully putting pressure by her thumbs at Ausamarma, which works on Vishuddha, that is fifth chakra, the throat chakra, Udanavayu, upward movement of prana, and the brain. Let me tell you that this time, to have a forceful action of the diaphragm as well as the throat, the mother was not having an energy. She needed something which will help her to throw that piece of meat. And the Catherine remember the relationship between the Amsa Marma and the throat chakra, Udana Vayu, and action on the brain. So on the shoulders with her thumbs, she pressed forcefully, and see the magic. Within a fraction of second, the turkey meat piece came out of her mother's throat, and she was relieved. This again proved that proper understanding of sight and action of marma can save the life. Yes, yes. These are not only the historical part. This is really practical. So I will suggest you every week you must concentrate on one marma, try to understand, read its connection with the different srotas so that you will also use them. Since 1974 to 1994, we ran a private maternity and Panchakarma indoor hospital named Atreya Rugnalaya. Many normal deliveries, few with forceps, and some time through Vamadevi Yashasra Karma, cesarean, we have done. So we were having all the time the emergency. So let me tell you our example from our own indoor hospital. In the process of labor, what happens if the labor is prolonged? The pains are coming, but if there is no dilatation of the cervix, and if the delivery and the labor process is prolonged, or if the amniotic fluid is mixed with the meconium, then because of the fetal distress, babies were not crying after the delivery. Prasuti Paschat, and unless they cry, how their respiration will begin? It's a dire emergency. At this moment, usually what we were doing, we were just holding the baby upside down and patting on their back. Sometimes we were just sprinkling or throwing water jets on their body to give them little shock. But many times we have seen that if we put our little finger into the oil, dip into the oil, and gently put this little finger into the Buddha Marma. I repeat, if we put a little finger, little oily, well lubricated into the Buddha Marma, that has a connection, and immediately they were starting to respire and cry. So it is not always now. So this is very important, connections and the different marmas. Please remember, in the classification, we say that Buddha Marma is Sabjak Pranahara Marma. That is true. But many times we have to work as a surgeon. The most of the cases were coming with fishery nano, that is Parikartika or Arsha, Budarsha or Bahya Budarsha, Abhyantar Budarsha, and we are supposed to work on that area. So be cautious. Don't go haphazardly. It is known that if you just put something bigger without notice, the person can go into the cardiac arrest. Yes, Buddha Marma is Sabjak Pranahara. But if you use it in a gentle way, it can save the life of a baby. The next example I wanted to give you is a very different type. It is not the life-saving situation. We were traveling in the Latin America, in the Brazil, and demonstrating the Ayurveda, effect of Ayurveda in the different universities. So while introducing Ayurveda in one of the medical university in Curitiba, one of the beautiful city in Brazil, many curious students, teachers, professors, trustees gathered in that convocation hall. So they were very much curious. This was very new to them. The preventive aspect as well as the curative aspect. Swasthasya swasthya rakshanam and aturasya vikara parimokshaha. And so they were listening to us. Meanwhile, a strange insect bited a forearm of one of the girl students. So one of the insect bite, one of the student got on her forearm. She developed, as it was a very strong and the bigger one, she developed redness, swelling, and pain. Her forearm started having lot of itching. She came forward and through the translator, because they speak the Portuguese language, she asked us if Ayurveda has any treatment to overcome such an insect bite problem. Now remember, this is an emergency, not a problem to the life, but it was an emergency. Insect bite. This happens here and there. And she was asking, we were our examination. Fortunately, a rough stone and the red itchy forehand. Instantly, she started feeling cool, no itching or pain. At the end of my lecture, I'm going to show you the photos, whatever I'm giving you the examples, so that you will realize. I thought that not to show you them in between. So I will show all the photographs of my examples at the end. Another example I wanted to tell you what can happen. Swallowing of liquid ammonia. A 15-year girl from village came to stay with her uncle in Pune city. Remember, this can happen anywhere. So a girl came, she was curious to know the city. So she came and stayed with her uncle during the um, her vacation. That was a strong summer, a month of May. She felt thirsty and she went to the refrigerator at her uncle's house, picked up the bottle and started drinking so-called ice cold water. But with few sips, let me repeat, with few sips, she felt very strange, burning sensation in her throat, followed by nausea, vomiting, giddiness, and fainting. Because it was not a cold water. Her uncle had ammonia printing press, and in a hurry, he kept liquid ammonia bottle in the home refrigerator. They rushed her to our hospital. What to do? They came like that. Uh, we decided to treat the case as a accidental poisoning. I told you that we have worked in the casualty department in our beginning of uh, course, BAMS course, and that's why we were used to that. So the first thing that we have done is when she vomited, we collected that sample so that if anything happens, a police case happens, we can show the sample. Then we put the Riles tube and we have aspirated the few things from inside. Then we have done the stomach wash. Usually the people do the stomach wash with the namak, the salt water, but we thought that as it is irritating, we have put a ghee in the warm water. Then we have done the stomach wash. So she felt better. Then we have taken out the Riles tube. Gradually, we have taken out the Riles tube and asked her to swallow milk and ghee. Remember, she was in dire necessity. She means who? Her throat, her esophagus, as well as her stomach. They were irritated. They were very angry because of the ammonia. And to heal irritated throat, esophagus, and stomach, she recovered within 24 hours. Now I will give you another example. I am talking about Rakta Mokshana. It is not always Burmas. In Panchakarma, usually we do Vaman, Virechan, Basti, Nastya. Nastya, I have given you one example of Pradhamana Nastya, how it is useful in emergency. Now I want to tell you how the leech application is very useful. As a maternity home, we were having many deliveries. The primipara, the first time, the first baby, they are not used how to feed the baby. So usually they have a lot of the breast milk, and if they don't take it out, and if the baby doesn't, that turns into the stanavidradhi, an abscess. Now all of us, we have studied that abscess has three stages: amavastha, pachamanavastha, and pakvavastha. If it is ripe, if the pus is formed, then everyone knows that Chedan and Bhedan, that is inside and drain, this is the treatment. But when it is in Amavastha and Pachamanavastha, this pain, severe pain, is because of the tension, accumulation. The same, I give you another example. In the practice, everyone, we have the nails. And if any infection happens in the nail, the skin is very tense. We call in Sanskrit this condition is chippa. And in modern medicine, they call it as paronychia. This stage is also very, very painful. The people, they cry. They are not able to sleep. Even the analgesic doesn't work. In such conditions, I have seen that the leeches are very, very useful. We apply them. Even I will tell you that the thrombus piles, hemorrhoids, which are very tense and blocking all the anal area, and we can see them. You can just ask the person to sleep on the left lateral or right lateral position and apply the leeches. What the leeches do? The leeches can reach up to the capillaries. They don't know which is the pure blood and impure blood. They are just, if you put them, and they will start sucking the blood from that area. And I'm giving you three examples: Stanavidradi, Chippa or Paronychia, and Budarsha, which are inflamed and having restless position. In such conditions, according to 1 square centimeter or one leech, like that you can apply 5-6 leeches, and within, I will tell you, within half an hour, once they suck the blood, the tension becomes less and the persons get relieved. So this is also a emergency treatment. So Rakta Mokshana, I have worked a lot about this, and I got a very nice results. Now I wanted to tell you something about Karana Shula, Shalakya. Karana Shula, the pain in the ear, is a very otitis media, what is called as an emergency. This is also a common complaint. Sometimes there is a tinnitus, that is Karananada. And so what to do in such people? Here,
सर फोटोज खींच रहे हैं
here,
सबकी
here we have seen that the mooli, the radish, we can prepare the medicated oil out of a radish, or sometimes with the pepper. And if we keep it warm along with the garlic, and if we put it either on the right and the left, the pain gets relieved. One other example I want to give you. This has happened in our Maharashtra. One of my students, he was practicing in a very remote area, what we can call where there are no buses, there are no roads. If the people have, there is no primary center, health center. The people are deep in the forest. And once I remember that he got a case, a baby, I mean, the person was having a vomiting and diarrhea, what we call as gastroenteritis, chardi and atisar, and he was dehydrated. And if he has to come to the health clinic, they have to bring it, putting him into the, what I will say, the bed cover, and putting him on the bamboos and bringing him from the forest. And it will take more time. So he decided, he asked them, can you apply oil? Because the skin becomes dry, and even they do some oil massage that can be absorbed by the body, and till he comes to the primary health center, he can be little bit hydrated. But those people were very, very poor. They were not having even oil also. They were not even having the cows also. They were having just the sheep and the goat. Then he remembered that then he asked them to put the goat milk Do you believe? They asked him, whatever you have, that milk, you start applying it to all the body. Remember, the biggest organ in our body is skin, not liver, not brain, not spleen. The biggest organ by surface is our skin, and they have done it. Whatever the goat milk was there in the home, before they bring it to the primary health center, they have applied it all over the body, and it has been absorbed, and he survived. So this way, we are supposed to use the common sense. That is very, very useful, and if we do that, it is very useful. I have few examples more. Trigeminal neuralgia. I am now talking about Gandusha and Kavaladhara. See, when we talk about Shalakya, it is easy to reach and treat the oral pharynx, the problem with the throat. But if the problem is in the nose, or if the problem is in the ear, there is a tympanic membrane, Karna Patala, and we cannot go inside that. So how to treat? The simple way I want to give you the message that any problem related with ear, nose and throat, the best is Gandusha. Gandusha is gargling. And my favorite is Triphala, which is easily available. So you can prepare a Triphala decoction, but my idea is never ask the person to do the gargling with only Triphala. Ask him to add some oil. If sesame oil is available, best. But otherwise, whatever oil they are using in the kitchen, maybe sunflower oil or coconut oil or the sarson ka tel, whatever the oil is there, they can add it and they do the gargling. With the gargling, the eustachian tube from the ear, they open into the throat. And so the problems of the ear can be solved with gargling. And pranavah srotas, they are connected with the respiratory system. So muhur muhu, every after, according to the problem, we ask them to do this gargling 4 to 6 times in a day. Sometimes Kavala Dharana is useful. I've given you the example of trigeminal neuralgia. All of you know that we have some of the nerves which comes from the brain itself, and they go and they are very useful. One of them, trigeminal nerve, which comes to the face, and if it is blocked and having pressure, the pain is very, very severe. Even no injection, analgesic injection can stop that. But we found that if we make the sesame oil with little pinch of just salt, sandal, and make it warm and hold it into the mouth. I'm not asking to do the gargling. Hold it, Kavala Dharana, for some time. The effect goes, there is a relaxation, the pressure on the trigeminal nerve comes down, and the people start feeling better. Another thing, I have worked in the operation theater, and after the surgery, especially after the Gilayu Nirharan, I mean the tonsillectomy, when they become conscious, they were having very severe pain. And then I went through the Sushrut, and Sushrut had mentioned that Yashti Madhu, the glycyrrhiza glaba, is very useful. So we have prepared a medicated ghee as well as the oil out of Yashtimadu. And when we apply it to the any wound which is having chronic non-healing wound as well as the area which has been operated, the healing is faster and the pain is also not there. So this way, my dear friends, I want to tell you that Ayurveda is not only for the chronic diseases, it can work very well with some of the medicines, with Panchakarma and with the Marma therapy. You can face such problems anywhere and you can treat them. Now I request Poonam to show the few photos. I will make a running commentary when she is showing you the photos. Okay. So emergency treatment through Ayurveda. This is the Kshipra Marma. I am showing you both the slides. One, how it looks in between. So while watching, you can also try. Keep the two fingers, middle finger and the index finger down and with the thumb try to press, you will find it is very irritating. So this marma we are using it to make the person conscious. Okay, so this is one of the very important marma. They are four: two here on the upper, I mean the palm, and two on the toes. On the palm, in between the thumb and the index finger, but down the great toe and the second toe, like that. The next, please. Poonam, the next, please.
Sir, we are on next.
Please show the next slide, please. The next photo. Anyone is there? Okay, so I will, no problem. Now this is the Tala Rudaya. Okay, this is the Tala Rudaya, and the arch. Now this Tala Rudaya, with this I remember that we don't have only one heart. We have five hearts. Four in the two palm, four, I mean the two in the palm and two in the our feet and one here in the chest. So if the person is unconscious, even in the villages, people know that they are supposed to rub their palms as well as the feet. Why we do that? Because there are so many arteries, and so if we rub these areas, the circulation improves and the person becomes conscious. So this is also a very important marma. Now here I have mentioned you that in Brazil, one of the students, she got an insect bite. And you can see here, this is the red sandalwood doll we always carry with us. We have prepared the paste and applied here on her forearm, and immediately we were able to show that Ayurveda works instantly. So I have seen that nowadays we just sit like the modern medical people and prescribe the medicines. It is not good. As an Ayurvedic physician and surgeon, you are supposed to prepare your own medicines. And as we use the internal medicines, the external, lepa chikitsa, is equally important. Try to use it. There are many people nowadays, they have to go to study or for their work in the different areas. And when they come home, they have a severe headache. So everyone has a nutmeg in their house, a ginger in their house. So you can make the paste out of nutmeg as well as the ginger. We also add calamus, and then we apply that on the forehead. And within a few seconds, the headache comes down. I'm talking about Vata Prakopa. So you can apply warm oil and apply this type of paste. Now you see the Krukatika. Now the Krukatika, it is on the back that you see. This is the area where there is a mental stress which is get accumulated, and that's why our eyes become smaller, and our muscles of the neck, they become contracted, and we feel tired. So this is the area where you can apply the warm garlic medicated Lashuna Siddha Taila, which is useful to relax. Especially this you can do it if you have a lot of stress. Next. Yeah, this is one of the demonstration of Vidura Marma. I told you that life-saving marmas, one I have shown you, which is Kshipra Marma. And this is I am showing how you can put the thumb on the Vidura Marma. I repeat, this Vidura Marma is behind the ear lobes uh, down to the mastoid bone. Okay, there is a soft area, and actually the nerve is passing through it. And when we press the nerve, there is an irritation. This is very useful. Not necessary always to put the pressure on both. Even you make the person lie down and press on any one side, that is also very useful. Thank you. Next. the same, I'm repeating it on another student. So this way, when they experience themselves, they understand, and then they start using. The same way the Catherine, she remembered the one of the marma and was able to save the life. Now here I am showing you the
Yes.
same marma on the
Can
foot.
can you put the screen in the main screen because we cannot see the slide?
Now this is the Kshipra marma. Yes. Now are you able to see now? On the palm it is very easy to press, but sometimes on the feet it is difficult. But this also works very well. Kshipra marma. The next one, please. Yeah. Now here the person is unconscious. This is happening. This is I'm teaching in New Zealand. In the New Zealand, all there the medical doctors, and there is a big naturopathy college uh, in Auckland, and the person is himself who is lying down on the ground. Is himself is a doctor, and I have demonstrated on him how you can make him on one side to prevent the vomiters to go inside, and then to make him conscious and improve his respiration, how you can use one of the marmas. Actually, I am repeating the marmas because if I use other like Shankha marma, Vitapa, etc., it will be too much. So I'm just demonstrating you few of them. Thank you. Next, here, see, this is the action. Can you see that I'm holding his mandible, extending him so that the trachea is not flexed, and making him on one side. This is the very important position for any resuscitation anywhere. Remember this. Next, the leech application. I think all of you might be using them. I have worked a lot. I love these leeches. You know, our blood vessels, usually we take the blood out from the veins, which are very prominent. We can Siraveda, when we do the Siraveda, we can put the scalp pen needle or a syringe, 18 number of the needle, and we can take it out. But there are some areas where you are, like I mentioned you, the chip, paronychia, or there are some of the areas where you cannot get the vein. So how to take the blood out? They come to our rescue, and when they are sucking, you might be knowing that their saliva, they put it inside. Do you know that they have like we have the upper and the lower jaw, they have three jaw, and when they have about 150 to 160 teeth, uh, like the like a raw, and so they put that inside, and from the saliva they put anti-clotting material, which is hirudine, which is present in their saliva, and that's why they were able to suck blood non-stop. Even they come out afterwards, also the blood comes out. Don't stop that blood, let it come. Our main idea is to let the blood come from the area where it is not possible to do Siravi, and this is one of the most important treatment in emergency. Next, here you see the Nabhi Marma. I have started my lecture with the example of a baby where the tummy was tense. But in reality, in our practice, there are many people who have admana, ajirna, ballotment, gas formation, and agnimandya. In such areas, in all such cases, I will suggest you not only to stay on uh, Gandharva Haritaki or Hingwastar, that all internal medicines. Why don't you try the other medicines? I can show you here. I have the Lata Karanja in my hand. Sagar Gota, what we call in Marathi, Lata Karanja. This is very hygroscopic. I have treated many cases of sudden swelling, either the obstructed hernia, hydrocele, piles. This is hygroscopic. It can, even in the acute arthritis, Similarly, haritaki. Haritaki is also very useful, and lepagutti that we use. So this way you can use different by lepa. One of them is Nabhi. So Nabhi Marma is one of the important Marma with which you can cure many conditions. Thank you. Next. This is happening. Her name is Gabriela Grimzel. She is a beautician from Germany, and she was very curious to know about the different marmas. This is the marma massage that I'm showing her. With this, I remember that the thickest. See, our skin is not same in on all our body. It is very different. On the face, it is different. On the neck, it is different. Similarly, on the head, it is the thickest one, the skull, and that's why even we fall a little bit, there is a lot of bleeding that comes out from the head. So here it has a blood. Even the arteries and veins, they also pass through this thick skin of the skull. And and so if we do a proper gentle marma massage, you can change the mood of a person. You can eliminate the negativity from the person. So we use this technique not only in the physical cases but also in psychologically depressed people also. Now these are the different marmas. Now actually this figure, this is little bit up. It should be here on this side, Fana marma. And this is connected with the olfactory bulb. And we use it for different type of nasya. Next. Yeah, this is the Shankha marma. And to your surprise, even though it is here, even though it is in between the lateral corner, Apanga Sandhi and Karana, in between that, this is connected with the digestive system. Do you know that? So if you do the proper massage here with ginger, asafoetida, I mean hing, shunthi, like that, and if you rub it with the garlic medicated lashuna siddha taila, the effect goes to the digestive system. So again, I repeat that the different system, Annavahasrotas, Pranavahasrotas, uh, Mutravahasrotas, they are connected with the different marmas. And if you work on them, the result you will see on the srotas, the Shankha marma. Next, this is again in the Brazil. The back is very important. And I just mentioned you about the scapula. This I am showing how to do the marma massage to the Amsa Falaka. You have seen on the shoulder how the Catherine has used this for the throat marma. Yeah, but here this is Amsa Falaka. Thank you. Next, Stapani. All the women they apply the kumkum. That is the area, the third eye, what we call as. And Stapani is very important to concentrate on our work. You might be getting different people that they say that we are not able to concentrate on our work. We are forgetting something. Memory is also lost. And so to stabilize their mind, this is the point. Even though we are showing it in between the eyebrows, even it little up on the forehead also, the effect is same. Because you know when we do give the Shirodhara, it is not in between this third eye area, whatever we are showing you here, but little bit up also. Usually we give the Shirodhara in this upper area forehead. So before anybody asks me any question, let me tell you that even though the Sapani, the position is here, this position is also very useful. And it is Shirodhara is little costly. I know that there are practitioners who are working in a remote area where their client cannot afford such a costly treatment. What to do? Then Shiro Pichu, I will definitely recommend you that the Shiro Pichu as well as the Pichu on the forehead, which is loaded with medicated oil, is good. Again, if you prepare yourself the fresh medicated oil, as I mentioned you, uh, like Lashuna Siddha, Eranda Snigdha, Sunti Siddha, they will be more effective because the Virya is good. So Sthapani Dharma. Next. Again, the Gabriela Grimzel, and I have purposefully taken this on the Sthapani Marma because this is the area I told you it is not only connected with the memories. Yes, it is, but it is a habit that we forget the good memories and always the bad memories they stuck up. So this take this negativity out, nothing but Marma therapy. So the Sthapani is also useful for the Marma therapy. I told you that we have 5 heart, 2 in the palm, 2 in the feet, and 1 in the chest. So Padabhyanga is very important. Even the feet represent complete body. And that's why if you do this, even you can feel, if you do the proper Padabhyanga, you can feel that the oil is coming up to the eyes. Nowadays, the people don't only have the physical stress, but they have a lot of manasikatana, the mental stress. Nothing like this. Ask the person to put his feet into the warm water, do the massage, do the little bit svedana, then take them out, make them dry, and apply an oil. A very good massage to the feet has many benefits. That's why we do the Guru Puja with the Padya Puja. Again, the Vidura, I'll talk a lot about this. What muscle that you see is the sternocleidomastoid. Here is the mastoid bone, here is the sternal bone. So this is the sternocleidomastoid bone, which is get inserted here. And in between there is a nerve. And that's why this marma, I am using it a lot. So thank you very much. I hope all of you have enjoyed my presentation. My idea to select this topic is I don't want a blame on Ayurveda that it doesn't work in emergency. I feel that all of us, if we decide to use, to come forward, understand the position, and use our knowledge and experience, it will work. Dhanyavad. Namaste.
Yes. Thank you very much, sir, for sharing wonderful experiences in enlightening us with kinds of different kinds of treatment to be adopted during emergency condition. And it's very important to take a prompt and quick action during the emergency to save a life.
Yeah.
And it was, thank you, sir. It was really, truly wonderful and inspiring session for all of us. And it has given us, given all of us a great sense of direction to work towards managing the different kinds of emergencies. Thanks a lot, sir. It was wonderful presentation. Now it's time for a question answer session. So if anybody is having any question, they can ask. They can raise their hands as well, or would like to share anything, they can share. Any questions from the viewers? They can raise their hands as well.
ललित जी नमस्कार।
Yes.
आपने सार्वजनिक आर्थिक चिकित्सा पर प्रकाश डाला। मैं ये पूछ रहा हूँ कि जब पाइल्स के रोगी की ब्लीडिंग बंद नहीं होती तो उसमें आयुर्वेद आर्थिक चिकित्सा में क्या दे सकते, उसकी ब्लीडिंग बंद हो जाए में जब हम उसको सर्जरी करवाते हैं या कुछ छाछ बांधते हैं तो उसमें वेदना के साथ ब्लड आ जाता है, तो उस समय क्या दे सकते हैं अपने आयुर्वेद में अपने को?
नमस्कार वैद्य जी, आप फिर थोड़े दोहरा सकते हैं क्योंकि मेरे समझ में नहीं आया कि आप क्या वोमिटिंग के बारे में पूछ रहे हैं, छर्दी के बारे में?
जो पाइल्स के रोगी हैं उसको जब छाछसूत्र बांधते हैं उसको तो उसकी ब्लीडिंग शुरू हो जाती है, तो ऐसी स्थिति में हम कौन सा पाउडर उसके डाल सकते हैं जिससे उसकी ब्लीडिंग बंद हो जाए?
अब एक क्षारसूत्र के मैं आपको कहना चाहता हूं कि मैं पीजे देशपांडे साहब के साथ 1 महीना रहा हूं बनारस में
जी। हाँ।
उनके साथ मैंने खुद क्षारसूत्र के ऊपर वो कैसे काम करते हैं उनसे मैं सीखा हूं। तो मैंने उनसे समझ लिया कि अपने ऋतु अलग अलग रहते हैं, जैसे कि ग्रीष्म ऋतु हो तो क्षार अलग इस्तेमाल करना चाहिए, जैसे कि वट है, पीपल है, उसके क्षार मृदु होते हैं। तो ऐसा समय यदि हो क्षार आपको क्षारसूत्र ग्रीष्म ऋतु में अपने रुग्ण के ऊपर लगाना हो तो आप मृदु क्षार इस्तेमाल करना चाहिए। यदि विंटर हो यानी शिशिर वसंत में शिशिर में हो तो अलग क्षार का इस्तेमाल करना चाहिए। और हम यदि रुग्ण को जलन होती हो या वेदना होती हो तो हम शतधौत घृत का उपयोग करते हैं।
अच्छा, कोई सर लेप लगा सकते हैं, उसको लेप ले सकते हैं, कोई लेप उसके वहां पर लगा सकते हैं
हाँ
शहद के साथ मिलाकर?
नहीं, वही मैं बोल रहा हूँ कि शतधौत घृत 100 टाइम्स वॉश घी जो है, जो शतधौत घृत नाम से उपलब्ध है। हमारे महाराष्ट्र में एक और कैलाश जीवन नाम का मलहम उपलब्ध है, कैलाश जीवन, वो भी हम इस्तेमाल करते हैं। तो शतधौत घृत और कैलाश जीवन, इन दोनों का अच्छा उपयोग होता है।
जी, धन्यवाद धन्यवाद धन्यवाद।
धन्यवाद सर। एनी मोर क्वेश्चंस फ्रॉम द व्यूअर्स? या आप अपने विचार व्यक्त करना चाहते हैं तो वो भी कर सकते हैं, या किसी तरह के सवाल है तो आप पूछ सकते हैं। एनी क्वेश्चंस? आप डायरेक्टली म्यूट करके पूछ सकते हैं और यू कैन रेज योर हैंड्स एज वेल। Any questions from the viewers? Okay, I think all is understood, sir. Thank you very much for a wonderful session and for being with us today. Thank you very much, sir. Now it's time to extend a formal vote of thanks. I invite Dr. Meenakshi Jaiska ma'am to please extend the vote of thanks for us. Over to you, ma'am.
Very good afternoon, sir. Vinamra pranam to everyone. It's an honor for me to have the opportunity to propose the vote of thanks on the 115th webinar of Gyan Ganga, a voyage of knowledge, a webinar series organized by Rashtriya Ayurveda Vidyapit. On behalf of organizing committee, I want to express my gratitude to our respected and renowned speaker, Professor Dr. Avinash Lelesar, for his knowledgeable explanation on the topic Ayurvedic Atik Chikitsa, emergency treatment through Ayurveda. Thank you so much, sir, for enlightening us with your detailed discussion on the topic. I would like to thank wholeheartedly respected Padma Bhushan Vaidya Devendra Triguna ji, President Governing Body RAV, for his blessings and continuous encouragement. I express my humble thanks to Vaidya Manoj Nesri sir, Advisor Ayurveda, Ministry of Ayush, for providing us his immense support and guidance. We are highly obliged to you, sir. I extend my heartfelt gratitude to Dr. Kaustubh Upadhyay sir, Advisor Ayurveda, also holding charge as Director RAV, for his constant guidance and motivation. I thank him for his valuable contribution and encouragement in all our efforts. I offer my sincere acknowledgement to the organizing team of RAV and the volunteers who work behind the scene for their tremendous efforts to make this webinar series a great success. I am also thankful to all the respected Gurujans and participants who are connecting with us continuously throughout this series in spite of their busy schedule. Thank you so much to all. I would like to inform that the topic and the speaker for the next webinar will be shared with you very soon. Thank you all and have a nice day. Thank you, sir. Jai Ayurveda.
So thank you, Dr. Poonam. Please convey my thanks to Devendra ji as well as Radhakrishnan and my friend Manoj Nesri also, and all of you. Dhanyavad. Thank you.
Definitely, sir. Thank you for enlightening us. Thank you very much. Now the meeting has ended. Participants can leave the meeting. Thanks a lot.